Good afternoon, everyone. On behalf of the Medical University of Silesia in Katowice, it is my great pleasure to welcome you all to our white coat ceremony performed for the second time in the history of our English language program. We are honored to have with us today esteemed Dean's authorities, Dean of the Faculty of Medical Sciences in Katowice, Professor Tomasz Francuz, Vice Dean of the Faculty of Medical Sciences in Katowice, Professor Aneta Gawlik-Starzyk, as well as representatives of teaching staff, Dr. Joanna Kowalik, and Professor Maciej Wybraniec. In addition, please join me to warmly welcome proud family members and friends of our students. Thank you all for joining us today to support our students during their celebration of this meaningful and challenging journey. I would like to extend warm welcome to the Dean of the Faculty of Medical Sciences in Katowice, Professor Tomasz Francuz, to take the stage.
Good afternoon. I'm a little bit jealous about, the applause. Yeah, no, but that's good. That's good. So, dear professors, dear academic members, staff, dear guests, parents, and most important part of our academic community today, our dear students, for you it's a special day because it represents the transition between the preclinical sciences and the clinical science. For you it's one of these memorable days in your medical career, very important one, because now you can fully enter into our professional medical community. Of course, already a couple of years has passed and you successfully complete your preclinical subject, which is a great achievement, but now you have to complete even more demanding achievements during your academic years, and based on the applause, I know that you already started it and you are interested and satisfied with the education level we already provide for you. White coat ceremony is a long-lasting tradition, or maybe not very long-lasting because it's maybe 50 years, something like that. But it's very important for all of you and for us as well, because with a white coat you will enter our community, you will be recognized as one of us, a doctor. You know that with a white coat comes a lot of privileges because the patients, other people will immediately start to identify you as a representatives of a very successful, a very important profession as a doctors. And of course with these benefits which comes from the white coat comes a lot of different responsibilities. You will start to represent a long-lasting lineage of doctors, which extends far to the past. And because of the achievements of the doctors in the past, now we are recognized as the highly important profession. And now when you will become one of us and you will start to wear these white coats, you will get all these privileges and responsibilities. And I'm pretty sure, and I know that you, because of your personal achievements, because of your dedications to medical professions, not only take these privileges, but you will extend it to the next higher level, which is highly expected from you. But I'm pretty sure that you are able to do that. So because of this very special day, I would like to congratulate you once more, and I don't want to extend this ceremony for too long time. I would like to proceed to the next steps of our ceremony. And please let me once more, on behalf of me and the Dean's Office and the Deans of this faculty, to once more congratulate you the huge achievements, and secondly, to congratulate you parents, because we are all here now because of our parents, mine, your parents, who support us in our life, and because of them, everything is possible. So thank you very much.
Thank you very much, Dean Francis. We will now have a pleasure to request the student government representative, Ms. Julia Kucza, to turn to our students with a short address.
Honorable Deans, distinguished members of faculty, their students, and their parents. It is a great honor to be here with you today on such a meaningful and symbolic event, your White Coat ceremony. This is not just another academic event. It marks a transition from learning medicine in theory to beginning to practice it in real life. Today I would like to talk to you about something very practical but also very real. What to accept when you enter your clinical years. Because while this journey is exciting, it can also be challenging, unpredictable, and overwhelming. And knowing what lies ahead you can make all the difference. Until now, your studies has been structured, predictable, and mostly based on books, lectures, and exams. But clinical sciences are different. This is where medicine becomes real, where knowledge meets responsibility, and where patients are no longer case descriptions on paper. They become real people sitting in front of you and trusting you. And that shift from theory to practice is one of the most important transitions in your journey of becoming a doctor. During your clinical years, your education will be center of hospital rotations. You will rotate through different departments such as internal medicine, surgery, pediatrics. And each rotation will expose you to different kind of patients, different perspective of patient care, different diseases, different teams, and different treatments. You'll spend times in hospital wards, operating rooms, outpatients, clinics. You will become more involved, taking patient history, assisting in examinations, and participating in discussions. One of the biggest change is that learning becomes more self-driven. You are no longer only absorbing the information, you are expected to seek it, connect it, and apply it. So what truly changed? First of all, your environment. You move from classes to hospital, from controlled learning spaces to the dynamic and sometimes unpredictable clinical settings. And second of all, your role. Even though you are still medical students, you are now part of the healthcare team. And patient may not always see a difference between you and a doctor, and that comes with responsibility. And third, how you think. Because in preclinical years, the answers were always clear, defined, and we always chose one answer from ABCD exam. In clinical medicines, things aren't always black and white. You'll have to learn how to analyze incomplete informations, how to make a decision even if you're not certain, and learn to accept that sometimes there is no perfect answers. And this can feel uncomfortable, but this is exactly what makes medicine both challenging and fascinating. So what should you really expect? You will meet patients with real symptoms, real fears, and real expectations. And sometimes cases will be straightforward, but sometimes they will challenge everything you think you know. You will learn the essential clinical skills, how to take a proper patient history, how to perform physical examination, how to present case clearly and logically. And at the time, you may feel overwhelmed, especially at the beginning. You may think like you don't know enough, like you're too slow, or like everyone knows more than you do. But remember that this feeling is very common, and practical years are not about being perfect, but they are about learning how to act in real life. And it's important to acknowledge the challenges. You might struggle with confidence, the hospital environment may feel intimidating, but you also have to manage your times between hospital rotations, studying, and your personal time. And there may be moments when you will question yourself, moments when you feel like you're not good enough or not prepared enough. But these moments aren't a sign of failure. They are part of the process. And remember that every doctor you see today has been exactly where you are now. And what matters is not avoiding difficulties, but learning how to grow through it. And when you enter the hospital, when you meet the patients, there are some things you need to remember. First of all, always introduce yourself. It's a simple gesture, but it can build trust and respect. Dress professionally, because your appearance reflects your role and attitude. Always be punctual and prepared, because it shows responsibility and respect for your team. Don't be afraid to ask questions. Observe doctors, but not only how they behave, but also how they communicate, how they treat patients, what they know. Avoid using your phone in front of the patients. It may seem small, but it can affect how you're perceived. Never pretend to know something you don't, because honesty is far more valuable than pretend confidence. Respect patients' privacy and dignity all the times, because it's the fundamental in medicine. And finally, be proactive. Don't wait for opportunities, look for them. You won't know everything, but you can always be curious, kind, and ready to learn. And this sentence captures something essential about medicine. You are not expected to know all the answers, but you are expected to have the right attitude, because curiosity will push you to ask questions and seek understanding. Kindness will help you connect with the patients, and never forget that they are real human beings, not just diagnoses and numbers of test results. And readiness to learn will allow you to improve every single day. And this is truly the beginning of your real medicine journey. The clinical years will challenge you in many ways, intellectually, emotionally, and personally. But they will also shape you into the kind of doctor you are going to become. Remember that medicine is not only about knowledge. It's about responsibility, empathy, and lifelong learning. So take this opportunity seriously and never forget why you chose this path. Thank you, and congratulations on beginning on your journey.
Thank you very much, Ms. Julia Kucha. Esteemed authorities, dear students, ladies and gentlemen, we have arrived to the key part of our ceremony, which is presenting white coats. Therefore, I would like to invite Dean Professor Tomasz Francuz, Vice Dean Professor Aneta Gawlik-Starzyk, Dr. Joanna Kowalik, and Professor Maciej Wybraniec. Now students will be requested to report to the stage in order pronounced by representative of the student government, Muman Muhammad.
Hello everyone, really excited to be here. Just before beginning the names, just so you know, there was an email as well for the women who, due to religious reasons, don't want to put the coat on. They can put on before coming onto the stage. So let's start with the names. First name, firstly, Muhammad Aman Arsalan. Virginia Vanessa Borchikovska. Mariam Fatim. So now Akash Krishna Kozikatil. Sara Tali. And the class president Yuli Lestrup. Other names different because
Read from the presentation.
Okay. I'll read. Just
But if
after
not-
this page, yes? Because
It's different?
because different to
Hola?
the list.
Okay, read from the presentation, okay?
Okay.
Focus on the presentation, okay?
Okay, just the
Okay.
presentation. Okay. Now, Kabasinga Linda Naya Cairo. Skyla Sikora. Sorry. There are only two names, so what should I do?
One?
There are only two names. Third one is already done.
Okay. Źle poszło. Okay.
So? Like up until here, it's
Yeah,
done.
but you should read from presentation.
There are three people missing.
No. Arkham Khan?
Yeah,
Yes.
she's the only one missing. Yeah? Arham Muhammad Ahsanullah Khan. Now moving on to the international program, Adeneki Adelosoye. Mansi Ananda Raja. Michaela Kameni. Zainab Ikhwan. Hussein Ikhwan. Liron Harel. Muhammad Khattab. Loai Kitaz. Nasibullah Shariati. Moran Salame. Yam Schwarzberg. Ophir Lustig. Shoham Efergan. Hen Buskila. Sigal Vorjev. Hashim Raja. Vindhya Manukaran. John Stephen. Liam Moshe, Nriman Aslah, Lian Abu Akel, Ilana Gabay, Dolev Barshishat, Abir Zeon Netanel Sasha, Marianne Sletleland, Tetiana Zekova, Zahra Zubair. Isha Wahid, Nama Dar, Kana Gledai, Now from my class, Masi Ahmadi. Anina Biju. Taki Bukhari. Huh? Usse pagruha. Hasib Ghayasi. Myself, Moman Muhammad. And our great class president, Mohad Muhammad. A bit of clapping, guys. Okay. Sona Teresa Jose. Pawan Yukob. Irina Moti. Aiden Alfasi. Tomer Marum. Sapir Behor. No problem. Einav Edri. Paz Gutman. May Dayan. Alexandra Alperin, Rostislav Stadlin, Yarden Goldstein,
Only two person of this lab is not here.
okay. Ayat Sadi, Samea Yasin, Tomer Calvo, Ala Suleiman, Isra Quader, Catherine Nambi, Mili Adineyev, Sweetbat Schumert, Moshe Meyer, Yisrael Polak, Lana Novzad, and Eva Mulligan. That's the end of it. Thank you very much for having me here, and good luck for your white coat ceremony, the journey. Thank you.
Thank you all for this white coat presentation. Dear students, as you have finally collected your white coats, please be invited to listen to the lecture addressed to you by Dr. Joanna Kowalik. Jakby co.
Thank you. A gdzie jest mikrofon? Gdzie? Okej. Okej, dobra. I to teraz już można? Tak, załączone jest?
To ten wyłączony.
Nie, załączyć możesz. Obydwa? O, dobra, no to okej, dobra. Your Majesties, this is my alma mater, Medical University Silesian. I was growing up here, my dear students. What? My dear parents, thank you that you gave us, your children, to Katowice for education, to be doctors, professional with compassion. You cannot do like this that you will not listen to my lecture, and you know it. In the end, I will ask all of you about the summary. It won't be long lecture, my dear students, but I would like, based on my experiences, I would like to give you some advices for now and for the future, with help of Albert Einstein, Steve Jobs, some of the others, and me, my dear students. This is white coat ceremony, and white coat is the symbol of being a doctor. What exactly you need in your future life, and patient need this to trust you. White coat, I will tell you again, summary. Symbol must be always clean, ironed, and fragrant, and you must forgive me for this, my dear students. You are so beautiful today, I can see you. What about is this lecture? This the title is Per Aspera ad Astra. What does it mean? I think you know, but this is true. Hardships to the stars. Now you are at the level of hardship, yeah? This theory, forgive me dear Dean, this biochem, this anatomy, and my small introduction to surgery and human bio. Always biochem was my competitor. Yes, this is your life for now. And sometimes it seems to be sometimes boring, but it's not, from my point of view. It's very, very helpful. Remember that you need this theory. This is your life, student's life now, but in the future. What I would like you to remember from this lecture, some advices for life, and two things. Always, do you remember what I asked about you, about what I was asking you, about this, that you must be professionals and you must be good for people? Then we have two things. You must be good, educated doctors, professionals, with compassion. I would like to tell you what is compassion. The definition of compassion is not that this is only the empathy, but compassion means activity. Then compassion with professionals, being professionals doctor, will give you the success. But let's back to the lecture per aspera ad astra, through hardships to the stars. Who stands behind these words? This is Seneca Younger. Seneca Younger, Stoic philosopher of the ancient Rome. What does it mean, the word Stoic? Stoic. It means that we have, not nausea. You wanted to tell me the answer for intussusception, my dear students. Okay, small break for I will know that you are educated good. What are the early symptoms of intussusception? Nausea, vomiting, paroxysmal intermittent colic pain. Thank you. My dear parents, welcome. Thank you that you came to help them, to be with them. I wanted to tell you, these people are like my children, really. Then, my dear students, per aspera ad astra, you are at the level of aspera, yes? This is the way you have chosen for 6 years, per aspera ad astra. You are, my dear students, at the stage of half and 2-3 months. You have not long way to the end. I wanted to give you some advices for you now, and I would like to give you some advices for the future. Look, advices for now, my dear students. Learn from yesterday. When you came here, you had some troubles with accommodation, with organization, with program, how to study. Learn from yesterday. You must catch the wild, live for today, and you must have hope for tomorrow. My dear students, dream big, but you know that the studying means work hard. And do not worry about mistakes. Mistakes are proof you are trying. Stay curious, keep learning. In the middle of difficulty lies opportunity. Remember, opportunity. Per aspera ad astra. What I would like to tell you to make you smile. Balance is important. What I would like to tell you, I'm unfortunately workaholic, yes? But I have peace of mind. I don't know if it is not opposite, but I am like this. My dear student, psychologist told me, Kowalik, 2 hours of sleep, not my, 2 hours of rest, 2 hours of studying. Now smile, please. Not always it is the way that you live now, but you must try to organize this life, your life here, like being in balance. Per aspera ad astra, what is balance? Balance depends on you. No one will give you the balance, my dear students. Balance is the secret ingredient to a happy and meaningful life. Balance is not something you find, it is something you will create. And the goal is not to live forever, because we will not. The goal is to create something that will. My dear students, advices for the future. Follow your heart, of course, but take your brain with you. Remember about this. Follow your heart, but take your brain with you. But this is this composition together taken. Be professionals with compassion. Be professionals, brain take with you. With compassion, follow your heart. My dear students, this is very short. Be brave, be bold, be beautiful, be you. Be brave, be bold, be beautiful, be you. Always. Always look on the bright side of your life. No depression in your life. Your time here is limited. My too. I'm older woman after 50. So don't waste it living someone else's life. Don't let noise of others' opinions drown out your own inner voice. Remember about this. And my dear students, this I love. Stay hungry, stay foolish. Steve Jobs. And we were laughing from this with my son because I wanted to tell you pride and lack of humility are the worst advisors. Remember about this. Stay hungry, stay foolish. Pride and lack of humility are the worst advisors. The only way to do great work is to love what you do. If you haven't found it yet, keep looking and don't settle. I will tell you something. I love my job. Per aspera ad astra, I wanted to tell you 5 important things for your life. Never stop dreaming, never stop believing, never give up, never stop trying, never stop learning. And my dear students, exactly for almost the end, I wanted to tell you not something maybe very, very popular, but this is the truth. Never give up on what you really want to do. The person with big dreams is more powerful than one with all the facts. And this said Albert Einstein. Per aspera ad astra. I wish you for the future compassion to patience through big letter P. Remember this. It is the symbol. It has meaning for me. And I wish you to become professionals. Definition of compassion, this is not equal like only empathy. Pay attention to definition of compassion. It is not only empathy, but compassion is motivation to help. Joanna Kowalik, workaholic, plastic surgeon, pediatric surgeon, my dear students. You are the best. You are my children. Really, I think like this. My dear students, be professional with compassion. I will tell you in the end one thing more. I think these dreams took me long time, 25 years. If you will take these advices to your heart, you will do this faster. Thank you very much. Good luck. Bardzo dziękuję.
Thank you very much, Dr. Kowalik. It is my pleasure to invite Professor Maciej Wybraniec to take the stage. Pointer zostawić? Tak.
Ladies and gentlemen, dear esteemed Dean, it's a true privilege. I have the chance, the possibility to speak to you today in this very memorable day. I think you will memorize this day until the end of your life because it's the time when you really become an ambassador of hope. This white coat is the symbol of hope for your patients, for your future patients, for your parents, for your wonderful future. But at the same time, the white color gets dirty very easily. So that's why it's a very difficult job. I will be at the other side, and you are those who really tackle it, try to manage to cope with this very hard work you will come across in your life. But I want to be positive, I want to be happy, and I want to make you happy today. So I will talk about the beauty of medicine. I hope I will try to convince you that you made the right choice. And this is a really good moment to stop and think about the road we're taking. So my road it began here in Katowice. Actually, it began 100 meters from here because I was born in this place. And then I went to Krakow to study medicine, and I went to California, and then I went back to my home. And I don't show it to show you where I were, which places I visited. I show you that the fact that you study abroad, study somewhere else from your origin is very good. And this is the thing you should continue, because learning by traveling, by getting to know new people, and proving yourself that you can manage to live somewhere and educate yourself is a very good thing. And it will make you develop your own skills for managing difficult situations. And my key learning points of this presentation to you is the fact why the beginning of clinical education and medical university should boost your dedication to learning. And I will try to convince you that it's a very good moment to stop and think about the methods we're going to use during the next 2 years to do it the best we can. And then I will show you how the constant curiosity you should have all the time during your studies is reflected by the rapid evolution of medicine. And I will show you my field, so cardiovascular medicine, how we changed our approach to treating patients in the form of a myocardial infarction treatment. Why it's important to select the knowledge? Because you come to our departments, we will show you how to treat patients, how to approach those patients. And then you come home and you try to learn the field. And it's impossible to learn it, because the amount of knowledge, the pieces of information that are coming to our mind are enormous. In every field of heart failure, aortic valve stenosis, myocardial infarction, myocarditis, this is the amount of medical papers, scientific papers, that's been published throughout the years. And there's an exponential growth in the number of the papers. So it's impossible for you to know everything, and no one is capable of learning it. But it is our duty to show you and select the information that's really, truly important for you to become good doctors. And this is my first advice. You should be selective, but in an intelligent way. You cannot memorize everything. And the brown vault, yes, is one of the sources of information, is a very big, epic, I'd say, book that contains more than 2,000 pages. It's impossible to know everything, every detail of this. But this is why you come to us. This is what you should get from your teacher. Your teacher should show you what's truly important. And we should lay ground for the principles of learning. So you should know you should get to know the medical thinking. The medical thinking is connecting the dots. So we give you know a lot of things about medicine, about the symptoms, science, treatment, but you should be like Dr. House. You should know how to infer something from this. And this is something we should give you during your rotations in our departments. And of course, define the scope of the material. This is what we said. So the teacher's true strength is measured by the success of his disciples. So how you will succeed is actually the measure of our achievements. So that's why I think it's the most beautiful thing to share your knowledge with your colleagues, younger colleagues. And this is something I would like to say, that we really value that you're here. We're proud that we have the chance to share our knowledge with so many beautiful people from all over the world. And finally, like, treating patients is one very important, our primary goal. But the secondary goal, we're treating our the future patients by means of teaching you. So this is something we should not forget. And there's a good example. Professor Michael Debeke, you'll probably learn about this Debeke classification of aortic dissection. Professor Debeke introduced this classification, which tells us how to treat aortic dissections. And at the age of 97, he developed aortic dissection. And he was treated according to these classifications, which gave him 2 more life years. Maybe not much, but he was 97. So this is the good example that if you share your knowledge, it will come back to you. And this is something you should always remember when you become doctors and you become teachers, probably. So the medicine in Poland is actually devised like this. It's slightly different than USA and other parts of the world. But this is why I show you this. During this time, also when you go to the medical rotations, you're going to have some clinical activities in our departments. You should not forget to learn the theory. Don't forget about this. It's very important. In Poland, we believe in theory because maybe we don't have that many ability to show you the practice, but the practice is also the most important thing, but it will get back to you. Don't forget about the theory. It's like towards the opposite trend, but you should always, every day, do your work and learn a bit every day. So micro-learning, so you don't need to spend the whole day, but every day should be focused on something, and it will give you a big strength you will have the chance to take advantage of in future. So micro-learning, every day of practical rotation should be focused on something, and make it fun. Don't make it hard work. It's hard work, but if it makes you happy, it's not a hard work for your body. And the seminars and lectures should be concise and provide the core curriculum. So this is something that is, of course, more for us, that make it easy. And this is a good way of learning. Like here, if there's going to be numerous diseases you should memorize. If you have one disease, stereotypes can be good, and they are not in a bad way. So think of a picture of a patient you treat, yes? Like a cliché patient. And in this way, you will learn the most common signs and symptoms of this patient. This is like the HFpEF, heart failure with persistent preserved ejection fraction. So These are the whole picture of this patient. If you memorize this lady, you will know it when your tutor asks you the question and when you have such patients in future. Also, holistic learning. If you learn all those, for instance, precipitants of acute decompensation of heart failure, yes? It's very difficult to memorize it. But if there's something you come across you don't know, jump to this part and learn about this, yes? Causes of pericardial tamponade. And there's something you don't know, jump to it. So it will enable you to be more effective in learning. And of course, asking questions. This is important. We Polish people, we don't like asking questions because we feel that we are like causing some turmoil, we're ashamed of it. I'm being honest, that's our nature. But asking questions is crucial, and you should not feel shame when you're asking a question. This is your duty to ask questions, because by asking questions, your teacher develops and you develop. Yeah, that's the truth. So we always should not forget about this. And of course, spend time to use internet, digital sources of education that should boost your knowledge. Take advantage of the simulation-based training. We have the big advantage here in our university and many Polish universities right now to have the simulation-based learning. So I want to show you that the curiosity pays off. This is the list of the cardiovascular disorders and the causes of death. And you see that heart diseases are the primary cause of death. And the ischemic heart disease, myocardial infarction, is one of the leading causes of death. And it was so throughout the years. The second cause are, of course, malignant neoplasms. If you take them together, then in some sources there might be even more numbers. But generally speaking, the majority of us will end our life with some sort of cardiovascular disorder. So that's why myocardial infarction seems quite crucial, because by slowing down the development of this atheromatous plaque, we may prevent myocardial infarction, which is kind of a very bad event in the lives of our patients. And the treatment of this myocardial infarction rapidly developed throughout the years. So in the early 50s, 60s, towards the 80s, the primary way of treating myocardial infarction was lying in bed. Aka rest in bed, or Aka as rest in peace, yes? So like the good advice to our patients with myocardial infarction, yes, we should rest. And at some point, we found out that anticoagulants, like vitamin K antagonists and aspirin in 1974, turned out to be good medicines in treatment of this disease, yes, to prevent further clot accumulation, but still it was not enough. And in 1958, and then actually in 80s and in 90s, fibrinolysis became the true effective method, first method of treating this thrombus that formed there. And this fibrinolysis then caused many hemorrhages, and that's why it led to further development of interventional cardiology and percutaneous coronary intervention and PCI with stent implantation. So you see that, but actually even in this city, in the 90s, this rest in bed was quite common, because even though these ways of treatment were devised, they were invented, they were not commonly available to all our patients. And throughout this 40 years, we managed to go from simply resting to very tailored invasive treatment of myocardial infarction. So this resting is something like I want you to memorize, that at some point it was a primary way of treating patients. But right now we want to mobilize our patients as quickly as we can, because we know that by not moving, they can develop deep vein thrombosis and pulmonary embolism. So the fibrinolysis was the first step. So we administered the recombinant plasminogen activator, which like mimics the action of our fibrinolytic system, and in this way we can dispose of this clot, dissolve it. But we are not treating the atheroma, which is ruptured. That's why in 1976, Andreas Grünzig, it's from, of course, from Switzerland, from Zurich, invented percutaneous coronary intervention, which revolutionized our approach to myocardial infarction treatment. And right now we have a very big knowledge about the anatomy and physiology of coronary circulation. We know we named all the arteries, we can visualize them in vivo and dilate the artery that is the cause of myocardial infarction. And this coronary angiography as a first diagnostic step leads to further percutaneous coronary intervention. And actually, look, we managed to do it not because it just came to us. We asked questions. And even the fibrinolysis, which we thought is a good treatment, turned out to be obsolete nowadays. We generally don't use it right now in this indication. And of course, it led to rapid development. It was not only good for our patients, but only for industry, for development of those devices. And so right now, we have the chance, you see there's an occlusion or nearly occluded artery, LAD here, and now we insert a guide wire and a balloon to perform the angioplasty. And the final results looks like this. And the patient doesn't develop a necrotic part of his myocardium. And it prevents, of course, heart failure formation. We also have the chance to see the artery from the inner side. We can put the guide wire, put the intravascular ultrasound probe, and we can see the dissection of the artery. We can do it even in optical coherence tomography. We have even greater resolution. So you see that we don't even only have an angiographic X-ray image of this artery, we even see the histology of the arterial wall. So we came from resting to seeing actually the conglomerates of macrophages inside the artery. We also can treat the complications of myocardial infarction. This is something that developed recently. We can use mechanical circulatory support. So we can, in a way, use an artificial inner heart. So we put an intra-aortic balloon pump, which is like a less developed, older method, but we can also use the ECMO, so we can even bypass the heart. We can use the impella, which is a pump that pumps the blood from the heart to the aorta. So these all developments led to the improvement of survival in myocardial infarction. And the mortality in the 50s was 30%. So 1 in 3 patients died of myocardial infarction. In 1990, because we got the defibrillators, we got the fibrinolysis, the mortality was 15%. Nowadays, it's 5% until discharge. Until 1 year, it's 10%. So you look 6 times less deaths due to the development of cardiology. So to summarize my speech, I want to say that there's always a certain degree of luck in pursuing medical career, and you will know it, and we all know it in our lives. But remember that your hard work will not vanish. It will thrive. It will make you bloom. And I would like to wish you all the best and congratulations on becoming nearly doctors. Thank you.
Thank you very much, Professor Wybraniec. Now I would like to welcome on the stage our foreign student representative, Mr. Mohed Muhammad.
So, Bismillahir Rahmanir Rahim. Iyaka na'budu wa iyaka nasta'in. Distinguished guests, ladies and gentlemen, I feel honored and I congratulate you all as your president, as the student government representative, and I welcome the parents and everyone who's here for us in our special day. And as you all know, we are here gathered for the white coat ceremony, and I'm pretty sure we just came here just to get our white coats, but we don't really know why is this white coat. What does it stand for? So I want you guys to take a moment to think about, like, why are we getting this white coat? Take 10-15 seconds. Think about it. Come up with the answer. I want to make you guys think. Yeah, he told us, but you have to think by yourself as well. Yeah, what does your heart say? Okay, I'm gonna tell what I think, and what I think is that this is a transition for us from a life of medical student to a doctor, to feel the responsibility we're gonna have as we will be seeing patients. We won't be going to classes like we go before. It's not going to be the same. We're going to be in a hospital setup. They're going to be real patients. You cannot go and on Google and look for it. Okay, well, the teacher's asking this. What should I say? What's the answer? So it's going to be very different, and it's a big transition which we're going to have. And you know, I was talking to some of my friends yesterday, and they were asking me. I'm not going to take their names. I don't want to embarrass them. And they were asking, like, after tomorrow's white coat ceremony, can we use the title doctor? And I was like, no, not really. I don't know. You have to ask the professors here. So for now, we cannot use it. We have 2 more years, and then we probably can use it. So everyone has different reasons why they have joined. I'm pretty sure not everyone has the same ones. But there's one common thing that we all share, and that we're going to share our whole lives. And that is a very important one. And that is, after God, the patients are going to trust you with their lives. This is very serious. Like, sometimes I think about this, and whenever my motivation to study is gone, I think about this, and it starts to come back, you know. This feeling to study more, to study a bit more harder, comes back, because people are going to trust you with their lives after God. Like, when we used to go as a kid to the doctor, we used to know that, okay, this doctor is he has the solution to our problem. If we go to him with a certain problem, he's going to give some kind of medicine or some kind of advice, which is going to help us. So we have to, now it's time to give that back. We have to be able, we have to study that much, we have to have that knowledge so that we can give back as well. And our journey so far has not been easy. It's been more like a roller coaster ride. Up, down. Sometimes it's at a peak and it gets very stressful, and sometimes it gets nice sometimes, yeah. It's not always that stressful, but you know what I'm talking about, so yeah. And I remember, like, last year we had an anatomy course, and whenever I talk about anatomy, people, like, they get serious, like, they are like in a state of shock, you know, because they remember the trauma. It's a PTSD. Before the pin test, it feels like the day of judgment, you know. The bell of the pin test rings and people start to shake. Hands shaking. Someone is about to cry. Someone is having an anxiety attack. You cannot tell what is happening. Like, you cannot explain that emotion that you're going through at that time. And if you pass, it's a good feeling, honestly. It feels like you have achieved everything in the world. But if you fail, oh my God. It's the worst feeling ever. But it is what it is, you know. This is what makes it worth it, you know. We are here now, we struggle, we put our hard work in, and now, look at us. We are almost there. It's the 4th year. And it would be cruel if I do not acknowledge our families, our parents, some of our here, and they have been there when we did not believe ourselves. We had no clue what's going on. For example, after failing an anatomy test, and then the call with your parents, it's an emotional one. And they're the one telling you then, yeah, you can do it, go for it. There's another try again, study more. Like, they are the ones who are pushing you, because at that time you're completely lost. You feel like, okay, this is the end of the world. And they are the ones who give us inspiration in these dark times as well. So I want you guys to give them a big round of applause, to your parents. You guys are heroes. And my biggest inspiration, I have 2 inspirations which inspire me a lot. One is this verse from the Holy Quran. It says, Allah does not burden a soul beyond it can bear. That means God, He only gives you that much responsibility or work or stress which you can really bear. So this was what stood with me in hard times, in anatomy classes, anatomy labs, pen test, histology class, and in all these times. And here I want to mention another guy, a very respected man back in Pakistan, in my village, my native village, who was really skillful. And whenever someone in the village had a problem with a bone, a broken bone, a displaced bone, they would go to him. They would just go straight to him, like he was not a doctor. He did not have a degree, but somehow he understood how the body worked. Like, he could understand the body. We have to study so much, but we still don't understand after so many years. So he could sense misdiagnosed bones, and there was no MRI machine, no CT scans, no X-ray machine. But even then, he could treat people. And he did this throughout his life, and he never charged a single penny. And that was my late great-grandfather, Chaudhry Rahmat Khan Varaj. I'm very proud of him. And he's been an inspiration since then. And now, for the final thing, I want all the students to stand up on their seat and raise their right hand. I'm going to take an oath from you. Stand up. Yeah, take your right hand up. Yeah, it's a joke. Now, after I say I, you're going to say your name. Okay. I promise to keep learning, keep asking questions, and to always double check anything we learn from ChatGPT before telling a patient. And on that note, here's to the doctors of tomorrow. Thank you very much.
Ladies and gentlemen, as we come to the close of today's ceremony, let us take a moment to reflect on the significance of what has just begun. Dear students, the white coat each of you now wears, it's not only a symbol of your entry into the world of clinical education. It is a reminder of the responsibility you now carry, the compassion you must uphold, and the lifelong learning that lies ahead. May it inspire you to serve with integrity, empathy, and dedication every single day. Congratulations once again. We are proud to welcome you into this demanding and meaningful profession and look forward to witnessing your journey, your growth, and the difference you will make in the lives of others. Thank you all for being here today and sharing this meaningful moment with us. As our ceremony has just come to an end, we warmly invite all Dean's authorities, teachers, and faculty members, as well as our students, to come up to the stage to take a picture all together to memorize this special occasion.